Thank you so much for your attention, and I invite Dr. Manish now. Thank you.
पे है कनेक्टर ये वाला है क्या अच्छा ठीक है ले HDMI
While it's coming up, I think the point of the good morning messages, at some point I'd started, sending back a message to any person who sends just this flower, said, prove it. Why is it a good morning? Like, what is this thing? And of course, Kuresh, I always enjoy when in this large group, suddenly somebody will start wishing a birthday message or something, and then Kuresh will say, oh, this is the number of this person. I actually wished him and he actually replied. So please go there. This is classic Kuresh. And whenever I see it, I said, oh, it's again, that same thing has started again. So Kuresh has kindly, asked me to speak on YouTube videos, and whether it's about sharing or whether it's about a show off, or what is it in our mind when we, and I think everybody has a different way of looking at it. I would say it's a bit of everything. There's a bit of show off. You do want to show what you do, and but there are a lot of other factors which play a role. And I've been on YouTube for about, I was just looking back actually, because when he sent me that, about 11 or 12 years maybe, the first time when I must have posted was that while back. And that time, my reason of posting was because I wanted to share. A lot of people are asking me, where can we see this video? It had won some prize somewhere, and these large transfer files were very difficult that time. The V transfers and all these things, the sharing on the drives was a bit difficult to share bigger files that time. And then suddenly I realized, oh, this is a better way. You just put it on YouTube and then send the link, and it's easy for an access. And that's how my YouTube thing had started way back in 2010 or 11. And now, of course, gradually I realized that yes, it's something. When you start getting a feedback, okay, like people start discussing some things and they say, oh, could you also post something on that? Could you also post something on that? So next time you keep it in mind, and you kind of make sure that you have a footage of something else that somebody was discussing, and you can do that. So I have like a vitrectomy based subheading channel on my YouTube, this thing which is on my name, and at the moment I have about 97 videos over all these years. And the way I post is a bit erratic. I don't have a like a absolute way that I do it every week or every 2 days, or there would be days when I have done some major editing and I would churn out 2-3 in a week and post, and then there may be a month that nothing goes through. So it's erratic, but I do it at my own comfort, will, or just something that I'm happy to share at that moment, and I just go ahead and do that. So if you look at this, this is the oldest set of videos on this, which is 10 years back, and that's how it had started. These were all these videos were properly edited with voiceover, everything, which was sent for some competitions, and those were the ones I was posting then. And then I realized that if I have to keep on posting these, it takes a lot of effort. So then I just did some good editing and then gave a description and sent it, because to give voiceovers for every one of them becomes difficult. So that's how it went on, and so on it has been going. These are the most recent ones. I think the last I posted was maybe a month back on these, and all these videos get seen not just by doctors, of course, it reaches out to all, but these go to a lot of lay people. And believe me, a lot of question, no matter what you post, a layperson will ask you, what about floaters? How do I get rid of my floaters? Whatever video you might have posted, you'll get questions like those, and then you have to in some way reply to that. And I've had patients who actually question me about the floaters, what to do, what this, and you tell them, okay, if it's mechanically there, we can remove it surgically. There are some videos on floaters also here. And I still remember a patient who actually came to me after that, and he did not have significant floaters which were operable, and it was one of those patients where you have to reassure that you have to live with whatever you think are floaters. And he went back and abused me on this, and he says, never go to this doctor. His claim is baseless and everything. So you can get these kind of things also on that. But on the other hand, our peer group, I think that's where you get the maximum inputs from. They ask you questions, relevant questions. They want to enhance their skills, so they want to share a tip on that. So it's a huge learning experience for me also to know how somebody else is looking at it. What are they trying to gauge through that? What questions are they asking? How do you do this? What instrument did you use for this? What is the option? So it's a great engaging tool, and it also gives you a lot of satisfaction that that you're reaching out to people which otherwise would not have been possible in that. So this is like some of those reply boxes that, there are some patients who are undergoing these surgeries, and they've probably come in through the keywords, and they will ask you, I'm undergoing a silicone oil removal, and what to expect and what not to expect from that. The other aspect is I have my own channel which is by my name, but I work extensively with Orbis. The cyber site is their channel through which they do all their teaching, and a lot of surgical videos related to all the specialties. So for retinal part, they use a lot of footage from me extensively. So I also have, apart from my own this thing, a lot of videos which are there on that. Plus every year 2 or 3 virtual sessions I do with Orbis, which reaches out to all their group across, and then they post it on these channels. So it's a great platform again to reach out to countries, people which otherwise may be difficult. Of course, through the COVID period, things have become much more common, the uses of this, but I've been doing this for the last 10 years plus. These virtual things which before Zoom became popular, we had already been doing all this with Orbis and CyberSite, and that time it was a very planned affair. A lot of things had to be looked into, if it will work, the connection is right, and how is it reaching, and now of course we do it seamlessly. And so I have a lot of stuff on Orbis which is there. So sometimes if somebody is going to this, then as a subheading you can go to CyberSite and go there. I also work with Vogue. They promote a lot of these video based because of their optics, their lenses which I use. So they have a forum on which they do a lot of teaching related to optics, and I do a webinar series with them on viewing and teaching which lenses to use and what is the footage you can get with what lens, and how best to get good peripheral viewing, or where to see macula better, and to show them with examples and there. And then I also have my second passion, which is photography. So that's also something that I share on these platforms to some extent, and also some of the talks. Narayan Nitrale a few years back had I talk on these things. So those are there on YouTube, and recently the Egyptian Society was doing around the world retina every day with a new person across the globe, a small part of a scientific talk and a small part of their social activities and their hobbies. So these are great platforms to be associated with through YouTube, which takes you to a much wider range of people. And it's not just YouTube. A few slides. I've realized that YouTube can take in longer videos and other things, and I'm a very visual person, and I know that today with time the attention span of people has gone down dramatically, and I use Instagram a lot for my photography as well as for fundus photos and a lot of these other things to play. And on Instagram, a video attention span which they allow is less than a minute. So I modified, now whenever I'm editing, if I see a good footage, I edit it to a less than 1 minute and keep it aside for just an Instagram posting explaining that particular step or that category. So it's always less than 1 minute to suit that podium. So it's an extension. It started with YouTube, but I think I now use sub-heading of a smaller size, smaller time frame video on this. So if you see my Instagram channel, Dr. Manish Nagpal, it's a mix and match of what I am. A lot of people tell me actually that why don't you segregate your photography and your this, because some people say, oh, it gets a bit of a mismatch that sometimes we are looking at this post and you have different people looking at. But I've not been able to convince myself that I want to have two different identities. This is me. I mean, on a day I feel I post a fundus picture. On a day I feel I post a wildlife picture, or so far it's been like that. And yesterday somebody was complaining because I launched that book and I've been the last 1 month only promoting that. They said we don't see any fundus pictures now. So I said, yeah, it will come. I mean, but it's just, you need to be on that mindset, is what. So this is what I feel about YouTube. It's a bit of sharing, it's a bit of show off, it's a bit of just being able to reach out to a lot of people which you would normally not reach out to. And it reaches out to your peer group and also to lay public. So you have to be careful what you put in, from that sense that it's also going to be read by lay public. Thank you very much, Guru.